Okay, so next is the rehabilitation medicine team. So today, Dr. Chan Su-Chin, the rehab physician in the Department of Rehab Medicine, is going to basically present, share the journey and the experience of starting or basically strengthening the pulmonary rehabilitation program. Is a more comprehensive multidisciplinary service in UMMC and also a bit of research related to it. And she has been involved in strengthening this multidisciplinary pulmonary rehab work and also research related to it in our department actually. So Dr. Chan, the floor is yours.
Good morning, everyone. I'm Dr. Chan from the Rehabilitation Medicine Department. And first of all, I would like to thank you, Professor Mazlina, for the kind introduction. And a very good morning to all and welcome to the breakfast at UMHealth. Today, I'm going to share our experience in setting up pulmonary rehabilitations in University Malaya Medical Center. So, pulmonary rehabilitation program is a comprehensive intervention based on the patient assessment followed by patient-tailored therapy. It can consist of exercise component where we actually include strengthening exercise, endurance exercise, interval training, and breathing exercise, together with the non-exercise training like education, behavioral change, psychological support, and nutritional advice, with the aim to improve the patient's overall symptoms, overall fitness, quality of life, and address the issues of anxiety and depression. And hopefully all these can help in the reductions in hospital stay. This is a systematic review published in the Cochrane. It actually includes 65 RCTs, which consists of a good quality paper that have like 3,800 patients in the studies. The review highlighted that pulmonary rehabilitations improve the patient's health-related quality of life for patients with COPD. And the results strongly support inclusions of pulmonary rehabilitations as part of management and treatment of patients with COPD. As for the recommendation, they said that the future studies will need to look into the components of pulmonary rehabilitations to be included in the program, as well as the ideal length of the program. So in the year 2017, in the recognitions of the growing global rehabilitation needs, as well as the underdeveloped rehabilitation service, World Health Organization has launched the Rehabilitation 2030 initiative. Pulmonary rehabilitations for COPD is included in the package of interventions for rehabilitation. And Malaysia, we are actually involved in part of the development team. So in Malaysia, even in our CPG, it actually recommends pulmonary rehabilitations for patients with COPD. However, Hospital Sedang is only the establishment with a formal structured pulmonary rehabilitation service. It's actually an outpatient 8 weeks program. So the program is like 8 weeks and they actually have a structured week 1, what program they will need to go through, week 2 and so on. So the other institution is mainly a physiotherapy lead therapy program. It's actually not a program, physiotherapy-led exercise training, where they focus on supervised exercise training and chest physios without a structured program. So this is mainly just the exercise component without the non-exercise component. So only a small fractions of patients have access to the service due to limited access. So in general, pulmonary rehabilitations can be divided into the inpatients model, outpatients model, community-based, as well as home-based. So in our hospital, I'm going to share our experience in starting inpatient service, outpatient service, as well as home-based service, targeting the patients with chronic lung disease as a sequelae of bronchiectasis, patients with COPD, chronic asthma, as well as post-tuberculosis. And for the past few years, we have quite a number of patients that have pulmonary complications following severe COVID-19 infections. So this is how we started. Just like any other institutions, at the beginning, we started with our pulmonary physiotherapy service that focused on the supervised exercise training as well as chest physios without a proper structured program. In the year 2020, we actually realized the importance of pulmonary rehabilitations and the needs of it. So we plan to start with a structured outpatient pulmonary rehabilitations program for patients with chronic respiratory disease. However, the program was actually, we was not able to carry out the program due to the COVID-19 pandemic that struck in, and also the movement restrict control that happens in the country. So in March 2020, we actually have started with the home-based pulmonary rehabilitations program. Why we started with home-based first? Because we noticed that there is this majority of patients with chronic respiratory diseases. They are mainly elderly with multiple comorbids. And during that time, the very initial phase of COVID-19 in the pandemic, these patients are advised to stay home and avoid social contact because these are the vulnerable group for severe COVID infections and the complications of it. Therefore, this has increased the patient's vulnerability to physical decondition. So to bridge the care in between to bridge the gap between the care, we actually have started home-based pulmonary rehabilitations program. Following that, few months later in June 2021, due to a sudden surge of severe COVID infections, where the patients have a number of Cat 4 and Cat 5 patients that require prolonged oxygen support and the prolonged respiratory symptoms such as breathlessness, unable to carry out their activities of daily living, unable to return to their pre-morbid status, we actually have started with our inpatients post-COVID pulmonary rehabilitations program for these patients, followed by outpatients program for post-COVID in November 2021. And in January 2020, we actually have started our outpatients pulmonary rehabilitations program for patients with COPD. And in future, what we plan to do is actually to have the inpatients program for patients with chronic respiratory disease. And also we plan to look into the community-based pulmonary rehabilitations together with the primary care team. So when we actually look into the data, it's actually very obvious. In the year 2020, we actually has a significant drop in number of patients who attend pulmonary rehabilitations, as well as number of patients who completed the program due to the pandemic. So to address the gap in care, we actually have started with the home-based pulmonary rehabilitations program. So how do we start with the? So I'm sure that on the first slides and along this presentation, you see the word Respire. So what is Respire? Respire is actually a global health research unit that focuses on respiratory health in Asia and is funded by the National Institutes of Healthcare Research from the UK. So the partner countries includes the countries that consist of low-middle income country, Bangladesh, India, Malaysia, and Pakistan. We have the aim to improve the respiratory health in the low-middle income country. So together with the expert from the University of Edinburgh, Bangladesh, as well as our team has joined in, and also 2 centers from India, we actually has attended a pulmonary rehabilitations virtual workshop. So what is being discussed in the workshop? We actually has looked through what are the assessments that are suitable used for the adaptations for a low resource setting, as well as right now, before we're going to start with home-based program, adaptations for remote delivery. What are the suitable assessment that we can use? Because like the guidelines recommendations mainly is actually from the high income country, which may not be suitable in our countries. And also, we also look into what are the components in pulmonary rehabilitations that we should use for adaptations in the low resource settings as well as a remote delivery. So we actually discuss on the exercise component as well as other components as listed. So we also look into the practical delivery considerations. For example, due to our limited resources, the number of staff members may be lesser than what they have in the high-income countries, and also the settings, what is actually suitable for the local settings, the length of the program, as well as the number of supervised and also numbers of supervised sessions and numbers of home therapy sessions, as well as the durations of the sessions. So prior to the start of the home-based program, we actually conducted a stakeholder engagement meeting to explore the barrier, challenges, and possible solutions to the implementations of pulmonary rehabilitation program in Malaysia. So this is a virtual platform actually attended by more than 100 physicians, consists of respiratory physician, rehabilitations, as well as primary care physicians, nurses, therapists, and medical assistants. What do we find in this meeting? So we found like the barriers to pulmonary rehabilitations implementations includes the low knowledge as well as awareness among our healthcare workers, as well as logistic and accessibility to the program. And also we have a lack of a structured program in most of the centers and patients' barrier to participants. So following that, we actually has conducted a home-based pulmonary rehabilitation program in the year 2021. So it is a before and after feasibility studies conducted in University Malaya Medical Center and Hospital Sedang. So the objective of the study is to determine the uptake rate as well as the attendance rate of the home-based pulmonary rehabilitation program, and to explore the barriers and facilitators of it, and to assess the feasibility of the functional exercise capacity as well as a health-related quality of life assessment. And we hope that this will help us to develop recommendations on future home-based pulmonary rehabilitation implementation strategies in Malaysia. So these are the components of our home-based program. Mainly there's 9 components, consists of assessment, and also the exercise component, followed by other non-exercise component. So with our limited resources, we actually has come out with the education booklet and exercise diary with the support from the Respire team. And in the education booklet is a very color booklet where we actually include the introductions of pulmonary rehabilitation, disease progress, and also what are the exercises that the patients need to do at home in a booklet form. Of course, we also provide video material to the participants in the pen drive version. And this is a very colorful diary. It's actually a very simple diary where the therapists will let them know, like they will need to document down on their exercise, what the exercise that they're doing at home. Do they actually do walking, stretching, strengthening, and bronchial hygiene? And do they have any exacerbations in between? So the results actually showed that the uptake rate was 93.3%. Only 2 dropped out due to hospitalizations. However, only 37% attended the post-pulmonary rehabilitation assessment at the center due to that COVID-19 restriction that forbade travels in Malaysia at that time. So we was not able to collect our post-pulmonary rehabilitation, post-PR assessment outcome. And from the qualitative strand, this is what we actually get from the patient. This is 72 patients with 22 years old patients with bronchiectasis. The feedback was, okay, it was very good. My breathing system is good. Now you know it's stronger. And we have interviewed health medical officer with 8 years service in pulmonary rehabilitation program. This is what the feedback. When we have this home base, we can give patients an option so that they can choose. I think COPD, maybe they will benefit more with center program. Home base, you really need to be disciplined to do all the activities. If centered base, they will provide with the supervisions and encouragement from the team. So following that, we move on to our inpatients pulmonary rehabilitation program. These patients are mainly post-COVID patient. Can see that our doctors is actually giving education sessions to the patient, and the therapies is actually at the very initial phase. The patient is still on oxygen. We get the patients to walk around the bed, and followed by the assessment. This is the patients where we actually have our medical officer standby together with the therapies as well as attendant, where the patient is doing a 6-minute walking test here. So in our inpatients rehabilitation service, we look into the 5 main components, namely general exercise, include the focus on general physical impairments as well as respiratory symptoms. And also we look into the functional activities for this patient as well as return to work, and psychological aspect, and also other issues that the patients may have, includes the cognitive issues, pain and MSK issues, fatigue issues, nutritional, as well as dysphagia, and also speech issues. Last but not least, the most important, education component. Along with that, we also has come up with translations for self-management after COVID-19 illness, and this is published in the World Health Organization's website with the link attached. And together with these, the framework that we actually has designed, our center has successfully enrolled 61 patients for our inpatients rehabilitation program after acute severe COVID-19 infections. And this is our outpatient setting. You can see that we actually have a very huge area where the patients can do a 6-minute walking test. And also the therapist is actually teaching how the patients on the exercise that they will need to do on the strengthening exercise and also endurance exercise. So this is an outline of pulmonary rehabilitations for our post-COVID as well as chronic respiratory diseases. It's actually a 6 to 8 weeks program, 3 sessions per week with 1 supervised sessions in the hospital and 2 unsupervised sessions at home. So, in our post-COVID program, we actually have a 6 weeks program, and 8 weeks program is mainly for those patients with chronic respiratory diseases. And this is the example of our structured program. You can see that the big one, after doctor assessment, they will have sessions with the occupational therapists as well as physiotherapists and so on, that you can actually have a look into it. And what's our future plan? In future, we plan to develop local and national strategies to come up with pathways for referrals as well and also to provide training modules to the healthcare professionals to enhance their knowledge, empower their knowledge on pulmonary rehabilitation program, and also to make sure that we can have a successful program. We plan to involve all types of stakeholders in our future pulmonary rehabilitations related research and also implementation. In long, we plan to expand our inpatients rehabilitation service for patients with chronic respiratory diseases, as well as development of community pulmonary rehabilitation program with the collaborations with the primary care team, and also the revisions of our existing education material, for example, our booklet and videos for better patients' education. Thank you.
Okay, thank you, Dr. Chan. That's a wonderful overview. I suppose as we can see, the UMMC wanted to start a structured, comprehensive pulmonary rehab program, starting with the COPD population, and somehow the COVID-19 pandemic has just propelled or significantly improved the process and involved the COVID-19 patients as well. So let's see if we have any question from the audience. Hold on. Okay, there's one question here asking, how do you select your patients to join the program? What is the process and the procedure to join this pulmonary rehab program in our hospital?
Okay, how do we select? We actually get referrals from the primary team, where the patient has still have ongoing respiratory symptoms, including those patients with chronic respiratory disease as well as post-COVID. As long as they actually have ongoing respiratory symptoms, and also they have functional limitations as a sequelae of the complications, it can be referred to our clinic for further assessment. From there, we will actually have comprehensive assessment and referral to the appropriate therapies.
Okay, just want to add on that. Do you have anyone that you think will probably not benefit from the pulmonary rehab program, or everybody is suitable?
Actually, we'll have to see the actually they will actually take the patients with mild to moderate group. The severe group, there will be another entity where actually the palliative team may actually come in as well. So we can work hand on hand together with the palliative team. Not to say about end of life, but actually to provide the patients with a better care and symptoms reductions.
I suppose if we're not sure which patient to refer, they can just refer first, and then you can actually just stream,
Yes.
and stratify them into which program. Okay, I don't see any other questions, or unless anybody wants to ask live, or you turn on the video and speaker, if that is allowed. I'm not sure. Because if there is no further question, then we can probably end the breakfast session for today. However, yeah. Yes, Prof. Ng, do you want to say anything else? I think
No, I want to say bye-bye.
Happy holiday.
Happy
Yes.
holiday.
Bye, everybody. Yeah, we're going to have a long break next week. Safe journey back home. And yes, I think those the two presentations are quite useful today and very enlightening. So at least we know what's happening in our own hospital, and hopefully, if you have problems, like I said, you can actually strengthen the religious coping part, which is really good. I think because our society in Malaysia is really one of the religious population if we compare to the Western countries, right? And again, spirituality doesn't really equate religion, but it's actually in one whole team. And also as like pulmonary rehab, those patients are the ones that most of the time they feel very hopeless and they don't know what else to do, because it's really with our breathing, right? And if you can't really breathe, you really feel like that's the end of the world. That's the end, for you, especially when you can't even walk for a few meters without having that problem breathing. And we hopefully, with the start of this comprehensive structured pulmonary rehab program in UMMC, we can help a lot more people, a lot more patients in the future. All right, then. I think I'll probably end this. Gong Si Fa Chai, thank you.
Yeah.
Thank you.
Goodbye, everyone.
Thank you, everyone.
Thank you, everyone.